Welcome to this training on the class member referral for transition process in the comprehensive program, provided by the UIC College of Nursing. This training will enable comprehensive program staff to understand the process for receiving referrals for class members to participate in the comprehensive program and complete referral documentation correctly. The information provided in this training module is outlined in Policy P1.01, Class Member Referral for Transition, and Policy P1.02, Facility Collaboration Concerns and Barriers. Please note that this training module presents an overview of the information provided in more detail in these policies. CCMTP program staff should read and understand each policy in detail. Class Member Referral for Transition, Policy P1.01. Policy P1.01 outlines the process by which prime agencies receive referrals for class members to transition through the comprehensive program. The process begins with Maximus's outreach and assessment of class members. Upon Maximus's completion of the class members' outreach and assessment, a referral will be generated in Assessment Pro, Maximus's proprietary information system, and submitted to the prime agency's unassigned referrals queue in Assessment Pro based on their facility assignment. In order to claim and complete referrals, prime agencies must register for access to Assessment Pro. Each prime agency must identify at least 2 Agency Access Administrators in the Assessment Pro system. The Agency Access Administrator can run reports, claim and complete referrals, access class member individual records, update demographic information, and is responsible for registering and terminating all prime agency reviewers. Prime agency reviewers can claim and complete CCMTP referrals, access individual records, and update demographic information. There are many Assessment Pro user resources that guide prime agencies in registering and utilizing the platform shown here. Those resources include the Illinois Outreach and Assessment Pro User Guide and the Maximus Tools and Resources page, which is also linked through the UIC Colbert-Williams website. The Maximus Help Desk is also available via email at iloa@maximus.com or by phone at 833-727-7745, option 4. The prime agency must claim all referrals for transition in Assessment Pro within 1 business day of the referral date. If the referral is received after 5 p.m. or on the weekend, the prime agency will use the following business day as the referral date. Please refer to the Maximus Tools and Resources page and Policy P1.01 Class Member Referral for Transition for step-by-step instructions on claiming referrals in the Assessment Pro platform. The prime agency must have dedicated staff responsible for claiming referrals daily. Those staff will also be responsible for opening the referred class member's case in the web app. Please refer to the Introduction to the Web App Orientation module for step-by-step instructions on entering referrals into the web app. When claiming referrals, the prime agency should download all supporting documentation used in the assessment process to be reviewed and utilized in service planning. All referrals will contain a transitional assessment summary and any supporting facility documentation used in the assessment process. Prime agencies will also have access to assigned class member demographic information and Path Tracker, which provides historical information related to facility admissions and discharges. The prime agency must initiate in-person contact and document contact with referred class members within 14 calendar days of the referral date.
As noted earlier, if the referral is received after 5 p.m. or on the weekend, the prime agency will use the following business day as the referral date. During the initial contact with class members, the prime agency must explain the program and related services. The prime agency must also review the CCMTP informed consent document with the class member, allowing time for explanation and for the class member to ask questions to fully understand the contents. A more detailed discussion of the informed consent policy, P0.12, and procedures for obtaining informed consent, see Orientation Module T0.2, Informed Consent.
The prime agency must finalize the first comprehensive service plan, the initial plan, within 45 days of the referral date. The initial plan will focus on goals and interventions relative to the class member's time in the SMRF or nursing facility in preparation for transition, for example, education, skill building, occupational, and nursing assessments. All comprehensive service plans are to be updated and finalized at minimum every 180 days. Additional updates are to be completed based on class member needs, including if there are significant condition status changes that will impact the class member's service needs. A signed and uploaded informed consent is required to finalize the comprehensive service plan, as it provides permission for needed data information sharing and communication of the class member's personal information across the CCMTP. See Policy P3.01, Comprehensive Service Plan Development and Transition Planning, for more details related to the Comprehensive Service Plan. Orientation Module T3.1, Service Planning, describes in more detail procedures for completing service plans in the CCMTP.
Policy P1.03, Facility Collaboration Activities, Concerns, and Barriers. Prime agencies must have a frequent presence in their assigned facilities for class members, as well as to build collaborative relationships with facility staff. The CCMTP requires that prime agencies have monthly contact, at minimum, with all assigned skilled nursing facilities and SMRFs to provide information about the comprehensive program and the referred class members. Continuous transition coordination is expected between the prime agency and their assigned facilities.
A goal of the comprehensive program is to minimize barriers to class member transitions. Prime agencies should work with nursing facilities and SMRFs to reduce barriers to class member transitions. But where those barriers cannot be resolved with the facility, they should be communicated to IDHS. After attempting to rectify the barrier directly with the facility, if it cannot be resolved, the prime agency must take steps to report the barrier to the Illinois Department of Public Health, IDPH, the state agency responsible for regulating skilled nursing facilities and specialized mental health rehabilitation facilities in Illinois, and IDHS, the Illinois Department of Human Services. Certain types of barriers should also be reported to the Long-Term Care Ombudsman. When reporting to IDPH and IDHS, the prime agency must complete the IDPH complaint form. The IDPH complaint form is used to initiate an investigation where licensing acts, regulations, and federal Medicare/Medicaid conditions of participation or coverage are an issue. The IDPH complaint form should include a description of what the facility failed to do under the Colbert-Williams consent decree, the date the incident occurred, the name of the class member or members involved, the name of staff members, both facility and prime agency, who were present, the location of the incident, and whether the facility administrator or social service staff were notified of the complaint, noting the outcome of the notification. When filing a complaint, remember to attach all supporting documentation. For example, emails indicating contact attempts were made, or notes with dates indicating that a phone attempt was made. In addition to filing the IDPH complaint form, if the prime agency is reporting a violation of the class member's rights, including abuse, neglect, poor care, isolation, or a lack of choices or meaningful activities, they should also contact the long-term care ombudsman via email or by phone. Current versions of all comprehensive program policies and forms can be found in the web app library, and educational resources can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk, linked at the bottom of every page of the Colbert-Williams training website. Thank you for your attention and efforts to ensure safe and successful class member transitions.